organs, the brain and heart. The World Health Organization says by 2020, around 25% of the population will be afflicted with psychiatric problems. And you might be seeing nowadays everybody has some unrest in his heart. On little pretext, people fight on streets, murders happen, and people at the high level take wrong decisions. All these are due to psychological problems, and the psychiatrist's job is going to increase. We are in much demand everywhere. It has been long known that what you think in your heart, it affects mind, and also what you think your mind affects your heart. You might have known that some people get a lottery of 50 lakhs, and suddenly he becomes so happy that he dies instantly on hearing the news. That is a fact. And only in 1628, English physician William Harvey noted that every affectionate mind that is attached either with pain or pleasure, hope or fear, it causes an agitation which influence effect up to the heart. You might have seen, you see some person, immediately you get pleased. Your heart pumps a lot of blood and you fall in love with him. He may be of either sex. But it is a fact. You see a person and you become so much attached to him on the love at first sight. It is known. But we'll now into here you see a troubled mind leads to troubled heart, and troubled heart leads to a troubled mind. Therefore, it is very essential. Our scriptures has always they have told that krodhat bhavati sammoham, sammoha sruti vibhrama, sruti bhransat buddhinaso, buddhinasat pranasyati. Always Krishna has admonished Arjuna to keep coolness of his mind, because unless you keep calmness in your mind, your heart becomes affected. And I will talk to a disease called depression. Depression is a common influenza of psychiatry. Everybody who is present in this room, outside this room, in this city, in the country, in the world, everywhere you will find people are depressed. Their causes are so many. The depression starts the moment a child is born, because you think, now I will go to a agency and arrange some money for his schooling. The moment you take him to school, immediately there is a donation of 1 lakh. Only just class 1, you feel depressed. Yes, class 1, 1 lakh donation. Then if he goes to engineering or medical college, some lakhs of donation. So everywhere, your life is so stressful, everybody gets depressed. But only psychiatrists are spared. Psychiatrists are spared. My boss says that, how are you so happy? I tell him, people take a small drink in the evening and they become happy. So in हिंदी इसको बोलते हैं कि लोग पी के खुशी रहते हैं. मैं हरदम पी के रहता हूँ, इसलिए खुश रहता हूँ. So psychiatrists, why they remain happy? Because they observe the sadness of others. It is true. If you observe others' sadness, you will become happy. If you just try to make others happy, you will become happy. If you try to make others sad, you will become sad. That is a law. So psychiatrists, they try to make others happy and they become happy. So these are the criteria, DSM-4 criteria of depression. And out of this one of the symptoms must be depressed mood or anhedonia. The symptoms must be present for almost every day for 2 weeks. Like your boss keeps a shout, you feel depressed. That is not clinically depression. I go somewhere and there my girlfriend rebukes me. I feel little bit upset. That is not depression. Depression means you must feel sad most of the time of the day for minimum 2 weeks duration. Then that will affect your heart. So this is a beautiful article that was published in Journal of American Medical Association. People usually believe that if you are depressed, it does not affect your heart. But over the period, people found out that those people who are depressed, they are more prone for heart attack, and also in those people who have no depression before heart attack, even after that also, the moment they become depressed, their mortality and morbidity increase so many times. So here they have studied 222 patients, and in American sample 222 patients is a very big sample, they say. In our country we get thousands of patients, but we don't record them. That is the tragedy, because we see so many patients in outdoor. Like in my psychiatric OPD, I see about 80 to 100 cases in a day. Whereas in foreign country, my friends, they don't see more than 10 cases. They say that, oh, you are seeing 60 to 80 cases, then you must be a god. They say that. We are not able to see more than 10 cases, they say. So where is the casualty? Our record keeping is very poor. We don't do any research work, because there is simply no time. You just hear the history and make a diagnosis and write the prescription and dispose them. But there what they do detailed analysis. First a person screens those patients, then he takes a detailed history, he sends to us. Then you also put so many criteria, do a lot of counseling yourself, then you dispose the case. But in our country, it is just not possible. Although we see so many cases, we just have no record of them. So they found out that it is so high that depression was a significant predictor mortality with odds ratio 5.774. That is, if a person is not depressed before onset of myocardial infarction, but he had onset of depression after myocardial infarction, then he is more than 5 times more likely to die out of the disease unless the depression is treated. But why this was not so much considered before 1950s? Because before 1950s there was hardly any medication for safe medication for heart. Most of the medications for heart, they cause much more damage to the myocardial infarction patient than any help. But now currently we have SSRIs and many other heart-friendly medications. So now they have done research. They have found out that if you intervene at the right time, your patient will be saved to a greater extent. Sorry. This is the, you see how is that work? Those persons who are non-depressed, and those persons, this is the mortality. So the clinicians, they can never neglect. If they want to be a good cardiological practitioners, they can never neglect the depression. Another study, it was published in Circulation. The patients were followed for 18 months. They have studied with depression inventory and Beck's depression inventory. The depression inventory scale and Beck's depression inventory, and the cardiac mortality was studied. All those known factors were controlled. Still they found out that the odds ratio is 7.82 and adjusted was 6.64. So you can just never neglect. If a heart attack person's wife is very bad, he is not liking his wife, then you must be very careful, because his death may be related to his wife. because he does not like his wife, he is getting depressed, and in his mind he always thinking about his wife who is very ferocious at home, and he says that it is better not to go home, rather die in this hospital, and you cardiologist will be blamed. You cardiologist will be blamed because he does not want to go to his home, because he does not love his wife, or otherwise also. Wife does not love his husband, and he just want to blame you, therefore will die in the hospital, and you will unnecessarily get the blame. So it is better to now we advise all cardiologists better to assess his mood, whether he is depressed or not. It is very easy. We have devised only two scale questionnaire. Just ask, what is your mood? Whether you are feeling depressed, most of the time this is the first question. Second, you ask whether you have any loss of interest in all pleasurable activities. This simple two questions. If a cardiologist or any physician asks the patient, and if he gets a yes, then immediately call for psychiatrist's help. He will give you the crown of success, which is not less, almost 7 times success rate. So it is up to you whether you ask the help of psychiatrist or not. This is a very big sample. 1250 patients of coronary artery disease. They were followed for this is published in the American Journal of Cardiology. I have intentionally taken out all psychiatric journal literatures, because then you will be feeling that probably as a psychiatrist I want to say that our work is better, and I am trying to propagate our psychiatry. No, I have intentionally chosen all cardiological literature. So what our cardiologists are telling about giving certificate to us. They have found out that when all other like smoking, all the lipid profile, all cardiac causes were taken into account. Still, they have found out that the presence of depression itself increases the mortality. Patients with moderate to severe depression have 69% greater odds cardiac death and 78% greater odds at mortality from all causes than non-depressed patients. So it is very essential to keep the heart attack patients happy. So someone suggested how to keep them happy. So people are now using musical, different type of musical tones, which are very pleasant in the cardiac coronary care units. Some people suggested, why not have beautiful movies inside the ICCU? But the psychiatrist objected. They told that if you have movie, probably the doctors will be more affected, because they won't leave the ICCU unit and their family will be suffering. So another prospective longitudinal study was done, having 284 patients with hospitalized with liver infection, and compared to non-depressed patients, patients who have moderate to severe depression has 84% greater risk at 5 to 10 years, because people wanted to know whether the psychiatric disorders have only immediate impact on the patient's health, or they are even effective on long duration. They have found out that even 5 to 10 years longer follow-up, the mortality and morbidity is affected due to presence of depressive disorder. Another study with acute coronary syndrome, this was done on the hospitalized patients, and they have same result. I am quoting different studies just to have an impact that we psychiatrists are also still important. You don't just neglect us. We can improve your patient's health by simply talking. This is another study. This is another study, and this one is a very important study. Here 1190 medical students they were taken, because it was believed if you take doctors and over years we will follow them, probably they will be a better sample. It was published in the Archives of Internal Medicine, and they were followed for 40 long years. Some of our psychiatrists suggested probably these doctors should have better result, because they move with sisters and all those beautiful staff around. They must have good result. But unfortunately that was not true. Still they suffered from depression. The incidence depression was 12% in cumulative analysis, and they have found out that they have still greater odds ratio, but it was less. It was the odds ratio was only 3. In other population it was 7 or 8, and it was suggested probably doctors they take better care of themselves. Still, if they suffered from depression after this myocardial infarction, and still they have higher death rate if they have onset of depression. There is another important factor, like a person who is depressed, he does not want to take medication. Why? Because one cardiologist counseled to a patient that if you don't take this medication, you will die. And the patient was laughing. Then the cardiologist asked, why? Because doctor, I wanted to die, and now I have got another instrument. If I don't take medication, I can die very safely. So it was cause to cheer to him. The cardiologist was seriously telling, if you don't take medication, you will die. Because suicidal tendency is one of the main symptom of depression, and the patient was happy internally. If I don't take medication, silently die, and doctor will be blamed. I will not be blamed. So it has found out that those persons who have depressed, they never want to take medication. There are 3 types. Either they won't take medication in right time, they will intentionally, if you take 3 times, they will take once, or they will not take at all, they will be totally non-compliant, or they will take more medication than you have advised. Suppose you take thrice daily, they will take 6 times daily. So there is depressed patients, the patients of psychiatric illness are totally unpredictable. Some people may forget also, like depressed patients, and they usually they skip the medication. So as a good cardiologist, unless you identify depression, your patients won't take medication and you will suffer. This is the statistics. Then the most important question, does the treatment of depression improve the outcome? That is one most important, because diagnosing something is not the answer. There are many things we diagnose but we cannot cure. So there was a most important study that was published in Journal of Medical Association. They only took sertraline. Now we have a lot of cardiologically safe medications. Earlier we did not have. Earlier we have only trazodone. But now we have found out that this sertraline, the SSRIs like escitalopram, citalopram, we have now got dianeptine, we have now got a lot of cardiologically safe medications. So this was a trial with sertraline treatment. They have found out that only simple addition of a single antidepressant in right dosage to a person who has become depressed after myocardial infarction improves the total overall prognosis by 3 to 4 fold. So you can see, along with your all cardiological medication, there are so many. But just addition of a single antidepressant to a depressed patient, it increases your power potency 3 to 4 times. So this is more important. So they found out that addition of simple antidepressant, they improved the in a depressed setup so bigger way. Sir, almost complete, sir. So now what happened? What is the recommendation of American Heart Association? The American Heart Association have now told that just you keep a psychiatrist ready for all persons who are having afflictions of the heart. Because heart is the center of emotion. Heart is the center of emotion. If your heart is disturbed, a psychiatrist help is a must. A psychiatrist will always screen all the population, whether they are depressed, your cardiac ill population are depressed or not. Then he will advise the treatment regimen for those depressed cardiac ill patients. And lo and behold, you will get the credit. Psychiatrist like an anesthetist will be always behind the operation table, and you cardiologists like surgeon will take all credit. This is the two simple question you can implement in your general practice everywhere. That you ask the patient whether you have little interest and pleasure in doing things or feeling down, depressed or hopeless. If this screening questionnaire, one of the question yes, then you must now subject him to the greater painful exercise of putting in a lot of DSM-4 questionnaire. Those who are cardiac ill, they must be kept in always good humor. And if you keep them good humor, your bank account will be much better. That is what the psychiatrists say. This is the statistics. If you implement the cardiac rehabilitation for depression with a psychologist or psychiatrist, your success rate will be 70%, and your death rate will be 17%. But if you implement a good cardiac rehabilitation, your death rate will be only 6%. So almost 3 times. This is published in American Journal of Medicine. In summary, the mood disorders, they occur in 15 to 23% of patients with coronary disease. It is not a small thing. About 1 in 4 persons suffering from any cardiac illness will have a depression, even if he does not have before onset of heart problem. Because a person when become cardiac ill immediately thinks about what will happen to my wife, what will happen to my children, what will happen to my 5 bungalows in all 4 metros. He always thinks that whether I am going to die. This simple thought, what will become of my job, this simple thought itself induces depression. So therefore, you must not take lightly any symptom of depression in your cardiac patients. And it will, if you have a right intervention strategy, your success rate will increase 3 to 4 fold. Thank you for giving me a patient hearing. I thank you all.
Thank you very much, Dr. Samantarai. Dr. Samantarai have told there are 2 questions. Right now he is seeing 80 to 90 patients. If you are going to opt these 2 questions, then the number of patients is going to be increased by 3 to 4 folds in your clinic. So I think it's an overwork to you. So for this reason we are not going. Any question by the audience, please? Yes, please.
So one question. When there is no psychiatrist is not available, should we supplement any antidepressant to all AMI patients? And if you do so, what is the drug of choice?
Sir, this is a very